Almost overnight, people around the world were forced to arm themselves with a flood of information about the coronavirus. Since then, COVID-19 jargon like mutation, variant and quarantine have become part of our everyday lives. But could the use of certain words, no matter how well-meaning they are, be deemed misinformation? One organization that aims to transform how healthcare is conducted says phrases like breakthrough COVID-19 infections could inadvertently support vaccine hesitancy. For more on this, we're now joined by Todd Malone. He's the managing director of BroadReach, Health Development. Todd, thank you so much for your time. What language or phrases in particular do you believe are doing harm to the message of COVID-19 vaccines?
Thanks, Tapuma. It's great to be with you this morning. One of the things that we've been talking a lot about, as you mentioned, is the idea of breakthrough infections, or the idea that when people are vaccinated, they can still get COVID, and that is a reality. That the vaccine, from the very beginning when it's been rolled out, has been meant to protect people against severe infection, against hospitalization, against illness, and even against death. When people hear that those that have been vaccinated are getting COVID, they think, well, then the vaccine isn't working. The reality is that the vaccine is working exactly as planned. And the vaccine is a great protection for everybody in South Africa and around the world to ensure that if they do contract COVID, they're not going to get a severe illness and they're not going to be in hospital. We're hearing from people on the front lines that almost everybody they see that's being admitted to hospital or is needing to be ventilated are unvaccinated. And people that have gotten their vaccines may get COVID, and it'll just be almost like a flu. And they'll stay home, they'll protect themselves, they'll protect their families, and then they'll move on with their lives.
So instead of saying breakthrough infections, what should we be saying, Todd? And it's such a small tweak. Will it really make a difference?
Yeah. Well, I'll give you an example of why it's a big deal. Is that, we've had the yellow fever vaccine for, I think, about 80 years. And in all that time, they have used the term breakthrough infections because that vaccine is different. That vaccine is meant to protect people from contracting yellow fever. And they have mandates in many countries when you enter there that they say, if you want to come here, you need to have your yellow fever vaccine. I myself have been subjected to vaccine mandates for yellow fever when I've traveled around the continent. And I think that language is appropriate for that vaccine. Well, people have adopted the same language for COVID, and it's a different process. And so if they're going to talk about breakthrough, they should talk about breakthrough hospitalizations or breakthrough deaths, because that's really how the COVID vaccine was set out. And all of the vaccines that we have options for are working the same way. They're protecting against severe illness. And so I just want us to get away from talking about breakthrough infections, because anybody that's hesitant is going to hear that in a very different way. And we know in South Africa that vaccine hesitancy is real. And so we need to make sure that we're communicating to people in a way that helps them get the information they need to make the best decision for themselves and their families.
Yeah, it's a very subtle but important difference that you point out there, Todd. Is there anything else in terms of COVID-19 vaccinations that we're getting wrong communications-wise?
Well, I think the most important thing is just getting that message out there as widely as possible. We're finding that in the big cities, people are getting more access to information, and on programs like ENCA, there's a lot more people reached. And so I think encouraging the government, encouraging public health experts to get on the show and talk about this. We know that your reach is dramatic. You get, the entire country gets covered, as well with radio, as well as other online mediums. And we just need to make sure that people have that information, because what people want to do is know what is best for them and then go out and get the care they need.
Todd, very quickly, I know your background is in work with HIV, and at the beginning of that virus coming into our world, there was a lot of misunderstanding and misconceptions about the virus and the disease it causes. Are there any lessons we can learn from how that communication was handled and how we changed perceptions of that virus and the disease it causes?
Sure. I think that's a great comparison. In the early days of HIV, I think everybody will remember there was a tremendous amount of fear. And the communication around it was really about trying to get people to be so scared of HIV that they would change their behavior. And fear it's just not a great communication tool over the long term. What you need to do is make sure that you understand people's needs, and then you're working with them in a let's say, a compassionate and thoughtful way, so that when they're deciding what they want to do and how they want to protect themselves, they have the information they need, and that they can continually present themselves to public health facilities and hospitals and be treated in a way with dignity and respect so that they can get their care.
Todd, thank you so much for your time and for explaining that little distinction to us. We appreciate it. Todd Malone is the Managing Director of BroadReach Health Development.